Thank you very much, Chairman, for your introduction. My name is Shinya Yamanaka from Japan, and it is a great honor to have become a new member of this academy. So I will do my best to contribute to this academy. I started my career as a physician, not as a scientist. Actually, I was an orthopedic surgeon 25 years ago. But after seeing many patients suffering from intractable diseases and injuries, such as spinal cord injury and cancers, I decided to change my career. I decided to become a scientist because it is a science which can develop new therapies for patients suffering from intractable diseases. However, making new therapies through basic science is easy to say, but it's very difficult to actually achieve. However, very luckily, we were able to develop this new method to generate stem cells, pluripotent stem cells, directly from our somatic cells, such as skin cells. In 2006, by introducing these 4 factors, 4 genes into mouse skin cells, we were able to reset the fate of skin cells back into pluripotent state. So we designated these new stem cell lines IPS cells, induced pluripotent stem cells. In the following year, 2007, we and others were able to recapitulate the same reprogramming in human skin cells. So IPS cells have 2 important properties. The first one is their immortality. We can expand IPS cells as much as we want. The second important property is pluripotency. From IPS cells, after expansion, we can generate virtually all types of somatic cells that exist in our body, such as brain cells, muscle cells, heart cells, blood cells, and so on. So now, in addition to skin cells, we can make IPS cells from many types of somatic cells, such as peripheral blood cells. All we need is a very small amount, like 5 ml of blood cells. By introducing those small number of factors, we can convert blood cells into stem cells, IPS cells. Once they become IPS cells, we can expand these cells as much as we want to a large quantity. And after expansion, by applying some cytokines or growth factors, we can convert IPS cells into many types of different cells, such as, I'm sorry. I hope this is supposed to beat, but I cannot make this moving, but we can make beating heart cells and blood cells, skin cells, many types of cells. So in 2010, 4 years ago, our university, Kyoto University, has decided to open a new research institute to facilitate medical applications of iPS cell technology. So the name of our research institute is Center for iPS Cell Research and Application, CIRA. For us, this one word, application, is very important because this is our goal. Our goal is not just writing papers. Our goal is to realize applications of this new stem cell technologies. So this is what we want to achieve within next 5 or 10 years. There are two major applications of this technology. First one is kind of in vivo application, also known as cell therapy. The other one is in vitro application. So we use iPS cells and iPS cell-derived somatic cells in laboratories, in toxicology testing, in disease modeling, and in drug screening. So in vivo application and in vitro application. Those are two major applications. Let me give you a few examples of in vivo application, cell therapy. The first application is age-related macular degeneration. This is a major cause of blindness in many countries, including our own country. Dr. Masayo Takahashi in Riken Institute in Kobe, she had just started the very first clinical trial using iPS cells in human patient. So she generated a functional sheet of retinal pigmental epithelial cells from patients' own iPS cells. Then she transplanted this sheet back into the patient's eye just last month, September 12th. So we are now checking the safeness and efficacy of this new treatment using iPS cell-derived retinal cells. Another application is Parkinson disease. Dr. Jun Takahashi in our institute, who is also a brain surgeon, he has developed a robust and very efficient way to generate dopaminergic neurons from human iPS cells. And he is now testing, he is planning to help to treat patients suffering from Parkinson disease by transplanting these dopaminergic neurons into the brain of patients. He is now testing this strategy in monkey model of Parkinson disease. So he is hoping to initiate human clinical trial as early as next year. Another application, this is not a neurological application, but also this is a very important application. Dr. Koji Ito of our research institute, he has developed ways to generate blood cells, platelets, and erythrocytes from human iPS cells. So he is hoping to bring this strategy to patients as blood transfusion. Many countries, including Japan, within next 10 or 15 years, we will short on blood donors because Japan is an aging society. So after 10 years, we won't have enough number of blood donors. So we need to develop some other alternatives. This is one of our hopes. We have been collaborating with Dr. Yoshiki Sawa of Osaka University, who is a heart surgeon. So he can now make this beating sheet of cardiac myocytes from human IPS cells. He has transplanted this kind of cardiac sheet into a portion peak model of cardiac ischemia, and he observed functional recovery. So again, he is hoping to translate this strategy into human patients within next 3 to 4 years. Well, Japan is different from other countries such as the US. We only have a very small number of cases of cardiac transplant each year to help these patients. Many patients are dying while they are waiting for cardiac transplant. So we hope that this strategy can help those patients in the near future. As for spinal cord injury, we have been collaborating with Keio University, Dr. Hideyuki Okano. This is our strategy. We can make neural stem cells from IPS cells, and by transplanting these neural stem cells into the site of injury, we hope to obtain functional recovery in patients suffering from spinal cord injuries. Also, we are now trying to apply this technology into cancer treatments, cancer immune therapy. So in patients suffering from cancer, their immune system try to kill cancer cells, especially T lymphocytes of patients try to kill cancer cells. However, in most cases, cancer cells are stronger. So T lymphocytes of patients are defeated by cancer cells. However, by applying iPS cell technology, we can rejuvenate cancer-attacking T lymphocytes. We can rejuvenate and we can expand T lymphocytes. Dr. Shin Kaneko of our institute is now developing this new cancer treatment. So this can be applied to many types of human cancers, including pancreatic cancer. So let me give you another example of IPS cell technology, which is disease modeling and drug screening. Let me use ALS, amyotrophic lateral sclerosis, as an example. ALS is also known as Lou Gehrig disease in the States. Lou Gehrig was a wonderful, brilliant baseball player back in 1930s, more than 70 or 80 years ago. However, at his peak, he suddenly became ill, became sick. He suffered from ALS, amyotrophic lateral sclerosis, which forced him to retire when he was only 35 or 6 years old, and only a few years later, he passed away. ALS is one of motor neuron diseases. In these patients, their motor neurons get degenerated and eventually die. Because of this, these patients progressively lose their ability to move their muscles. So in the end, they cannot move at all. And of course, they cannot breathe without the help of respirator. However, they can still think, they can still sense, they can still hear, because only motor neurons are specifically affected. Other types of neurons are intact. So again, patients can think, can sense, can feel, but in the end, they cannot communicate at all. So it's a very, very difficult, tough condition for patients and also for their family members. We still don't have any good cures for this ALS. We have a mouse and rat model of ALS, and many drugs have been developed on rodent, mouse, and rat models. They are very effective on mice, but unfortunately, none of them are effective on human patients. So we need to use human cells instead of mouse or rat model to understand and to develop a new effective cure for these patients. However, as you can imagine, it is impossible to obtain motor neurons from patients. Because if you remove motor neurons, that would patient or donor will completely lose the ability to move that particular muscle. So we cannot ask patients or any individuals for motor neuron biopsy. That's one of the causes of why we don't have good cures for these patients. However, now that we can use IPS cell technology, all we need is a small amount of blood cells or skin samples from patients. They don't mind providing us the blood cells or skin cells. Then we can convert patients' blood cells or skin cells into IPS cells. We can expand IPS cells to a large quantity. And then we can generate motor neurons from IPS cells. Dr. Haruhisa Inoue in our institute did that kind of has been conducting such kind of strategy. So he generated IPS cells from control individuals as well as from ALS patients. When IPS cells are undifferentiated, we did not see any differences between control and patients. However, when Dr. Inoue differentiated IPS cells into motor neurons, he observed marked differences, many differences. One obvious difference is morphological difference. As you know, brain cells, neurons have a long projection called known as neurites. So as you can see here, motor neurons derived from IPS cells, they also have long neurites. However, motor neurons from ALS patient IPS cells, he noticed that projection neurites are significantly shorter. So this is the average of multiple patients and control individuals. ALS motor neurons have only 50% length in motor neuron, neurite length. So using this as a model system, Dr. Inoue is now screening thousands of chemicals to find good drug candidates for ALS patients. He did find some good candidate, such as aquatic acid. So as you can see here, aquatic acid can revert the abnormal morphology of ALS motor neurons back into the normal morphology. So we are hoping that one of these candidates will help ALS patients in the near future. So again, this is what we want to achieve. We really want to bring IPS cell technologies into patients, into clinics, in cell therapy and in drug discovery. So again, we, Center for IPS Cell Research and Application, has been working very hard to apply, to realize those medical applications of IPS cells. We have more than 300 scientists and admin people in this building. So we really hope that in the near future we can contribute to new therapies for patients suffering from intractable diseases and injuries. Thank you very much.